Happy Friday, everybody. Welcome to the world's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, chest shape and how it affects breast surgery. This is something not a lot of people talk about, but it is important. And then a model's butt implant falls out while she's working out at the gym. How does that happen? And then finally, Sarah's going to teach me about something I know absolutely nothing about, and that is Sermorelin, a peptide that she tells me I need to be taking. And that's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer, Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Sarah.
Hi.
Hi, Sarah. In the box, Brenna. Second show. I feel like she's really got things under her belt now. Not that you didn't do a fantastic job on the first episode, but I have really high hopes for this episode.
Yes.
Are
It's
you
all weighing on you.
Are you doing okay?
Yes, doing well.
Okay, very good.
I think
Happy Friday.
you have like enough energy for both of us, I think.
I know you guys are gonna have to like tone it up a bit, man. Like I'm trying to like lift you guys up. I want you to share the energy, the excitement of talking about these awesome plastic surgery topics. You know,
Yes, sir.
I feel like Travis when he went off to do his radio show. Now he's like the plastic surgery expert.
He's going to be
Oh,
what are they called? Not an influencer of it, but like
Uh,
an advocate or
Plastic
something.
surgery advocate.
Like somebody like a spokesperson.
Yeah, right. He does know a lot. You too, man. Like you're gonna be
Yeah.
an expert. Brenda's gonna be the next expert.
Yeah, she's going to
She's
be
gonna
the
like share her wealth
spokesperson.
with like Generation Z.
Yeah.
Is it Z? You're Gen Z, right?
Yes.
Okay.
22. So.
Okay. Yeah, that's definitely Gen Z. I'm so excited about the generation thing.
Yeah.
Yeah. I mean, Trey was great, but that was two millennials. I felt like I was outnumbered
And
by
he,
millennials.
and he literally washed his face with like a bar soap,
Oh my
you know.
gosh.
Oh, I have to ask him how he's doing with this. I'm still using my special. So Brenna, Trey and I did like a man was it?
Skincare.
skincare. Yeah, I forgot the name of it already. We sell it in our office. It actually is pretty good. I feel like my skin looks good.
Mhm.
Yeah, I haven't. I actually took some pictures, but I haven't like taken the follow-ups yet. So I
Yeah.
don't know. So anyway, I'm going on vacation next week.
Oh. where you
So
going?
so we're going on a cruise
Oh yeah, you told me.
in the Mediterranean,
That'll be fun.
which we've never done that before. So we're excited about that.
What's the cruise line?
Norwegian.
Nice.
Yeah, Norwegian. So I'll send
Fancy.
some pictures on the gram. Take some pictures. Leaning Tower, Pisa,
Mm-hmm.
the Colosseum.
That'll be nice.
Yeah, it'll be cool. Kids are excited. Yeah, I'm excited to have some time off. It's been busy. It's been a busy summer.
So where do you have to fly?
Yeah, we're
To
flying to
Europe.
Barcelona,
Okay.
and we're in Barcelona like for a couple days, just checking out the city.
Yeah.
So that'll be cool. Although I heard like Barcelona doesn't like tourists.
Oh.
They were like doing something where they spray tourists with water guns.
Fun.
Yeah, I don't know. You know how people get like it's probably a trend, and now it's over.
Yeah.
It'll be fine. But I don't know. I'm excited. I've been to Spain. I really like Spain a lot, but I've never been to Barcelona.
Yeah.
I always thought Barcelona was on the top. It's actually on the bottom of
Mm.
Spain. Yeah.
Is that-
So if like you're at a party and someone asks you where Barcelona is, it's on the south end
Oh.
of Spain.
Is that where like are you gonna get to go to like a bull thing? Where they
A
go?
bullfight?
Yeah. Isn't that in
I
Spain?
don't know. I've actually went to one of those in Mexico like 100 years ago, like
I
back
thought
in
it
the 90s.
originated in Spain.
I think they did. Do they still do those? I think that like I thought that was like out of vogue, like bullfighting now
I don't know.
because of
They
like
still do it.
oh they still do it.
Yeah, I saw like an Instagram like reel.
It's
of,
really
like, this
dangerous.
man. Yeah, this man, like how they get ready with that crazy outfit
Yeah,
they wear.
they look like they're about to like go on stage at like old school Las Vegas
Yeah,
with
and they
that
all have
outfit.
the same body type. They're extremely like slender. And
Yeah, you can't be like you
look
gotta
like-
be like in shape. You're dodging bulls, man.
no, but that to me they look like ballerinas.
Dude, you know what's crazy is the running of the bulls.
Mm-hmm.
That looks really fun, but also
Why?
yes, why? I don't know. I don't know why people do it.
Tradition.
I guess. I mean, and then people like get hurt doing that all the time.
Well, yeah.
Like bulls are
Probably.
dangerous. I remember when I was a kid growing up, I had a lot of friends that had farms, and like they had a bull in the pasture. Like you didn't mess around with it.
Mm-hmm.
I think it'll come after you.
Yeah.
Yeah, they're dangerous. How did we get on bulls?
Scary.
Oh, right, Spain. Yeah. It's like, how did we start talking about bulls? We derailed ourselves. But anyway, I'll send some pics from Europe.
Yeah.
I miss you guys, so we'll see you next week.
It'll be,
We'll have to,
you're
I
gonna
think,
have
you know what I think I'm going to do for next week's episode?
Hmm.
I think I'm going to air yours and mine's first episode
Mhm.
because it's going to be really close to the time when you join the show, because you joined just like a few weeks after we started the show. So I
Yeah.
may air our very first episode.
Oh, good.
Do you know what we talked about?
No.
I have no idea either.
I was probably like even like 5 times more like silent than I usually am.
Five
I was
times more silent.
It's
Which
probably-
is not like you, I remember when we first met, like you're not like the silent type.
I know, but I think whenever cameras and you feel like everybody's like listening to you,
Uh-huh.
it kind of is different.
It is.
Like when you have, there's like, if you, so y'all aren't here, but there's like 3 cameras facing us right now.
At
And then
least
we can
3. There's
see
like an
ourselves.
army. There's like an
Yeah.
army of cameras.
And then we can see ourselves on a screen in front of us. So it's very like intimidating. So like our,
But not anymore, right?
no.
Yeah, right now it's like just like I remember the first episode I did. I was like, oh my god, what am I doing? I'm about to be on
Who
a
do I
podcast.
think I
Who do
am
I
right?
think I am? This is madness.
Yeah. That's what I felt like whenever you first asked me. I was like, oh,
Dude, but now
yeah,
we're like
so
practically famous, and we're gonna drag Brenna along with us.
practically.
Yeah,
Yeah.
Brenna's coming too.
Ready. I
Yeah,
have
Brenna.
My camera. We can go do it live from my phone.
Live from New York.
Yeah,
Yeah.
exactly.
Nip talk.
Dude, we're gonna get big enough. We're gonna get to like, you know what? I want us to. What was I want us to do? Like the Paris fashion or
Yes.
something where we ask people what they're
We
wearing.
just no, we asked people.
Oh,
what
with
their
plastic
plastic-
surgery. What plastic surgery?
How rude.
So, what plastic surgery have you had
What
lately?
plastic surgery are you wearing?
Oh my gosh, we're a mess. Okay, let's move on to some segments. So I thought of this segment actually from a previous segment that we did a few
Mhm.
weeks back. And I think it's important because it's something that actually matters, but no one really talks about. And that is, how does chest shape
hmm
affect breast surgery?
Yeah, because we talked about Tori Spelling.
Yeah,
Is that the
we
lady?
talked about
Yeah.
Tori Spelling.
And her chest has that like gap.
Oh, you know it. What's it called?
I don't know. I wasn't even about to say because I don't know.
Okay,
Let
but
me
yes,
go.
that is right. So we're gonna talk about chest shape and breast surgery because sometimes people want to make these perfect breasts, but if the chest wall, if the foundation is not right,
It's
it
not
can be
gonna-
harder to do, right? So again, this comes from the segment we did a couple weeks ago on Tori Spelling. And it's an important topic because if you have a chest wall, I don't want to say abnormality because that's negative, a variation.
Mhm.
I guess the technical word would be abnormality because it's not.
That's not normal.
I think it's more variation because they're so common that I wouldn't want to say it's abnormal. It's actually kind of common, but I don't know. I'm probably being like too PC. I mean, it's an abnormality or variation, however you want to call it. But if you have one of these things and you go and you get breast surgery, and that could be a breast augmentation, it could be a breast lift, even a breast reduction, it's going to potentially make the results be not what you expect.
Yeah, it's not going to look like the picture you bring in.
Right, exactly. And so, I do tons and tons of consults for breast surgery, and these things I'm going to talk about are actually very, very common. And anytime I see one, I always point it out to patients. And a lot of times, if they're subtle, patients don't even know they have them. Like they don't
Right.
know what they are. But I like them to know and be aware because each one has a potential different effect on plastic surgery. So I'm going to go through them. And then you're all going to be really educated and smart and can impress people at your next cocktail party about chest shape and breast
Let
surgery.
me tell you
Because
about
that
your,
comes up basically
let
every
me-
time
yeah,
at
let me
I'm
tell
out of
you
a
about
party.
your boobies.
Yeah, let me tell you about your breast. All right. So the first one is pectus excavatum, which is what Tori Spelling has.
yes, that little
Also, have you heard of that, Brenna? You weren't here. Were you here? For the,
I kind of. Is
Practice-
this the same photo? This one coming up? I think I recognize it.
okay, you were here. I think you were weren't you orienting with Trey that week?
I was.
Yeah.
All right, very good. All right, so you've heard of pectus excavatum. So this is Tori Spelling. Here, throw up the pic. It's that first one.
Yeah.
Oh, that's the title. Oh, Brenna, you forgot the title. That's a demerit for you today. One demerit for Brenna. You can make up for it, though. All right, it's the next one. Yeah, there we go. There, that's the picture. Yeah, so this is Tori Spelling. She's got pectus excavatum. It's that kind of divot in the center of her chest.
Yeah.
And she was talking about it on her podcast. We did a whole segment about it. But, it's more noticeable, one, because she lost a ton of weight.
Yeah.
And so she doesn't have that kind of fat
I
pad
don't
over it.
remember seeing that. My sisters used to
Yeah.
watch 90210 all the time.
Right.
I never saw that.
Yeah, because she had like, natural fat pad covering over it, which
Yeah.
made it less noticeable. And she got her breast done, which made her breast
She
big.
had her breast done multiple times.
Yeah, multiple times. Which now there's this kind of this divot there. And so, why it's important to know if you have pectus excavatum is because if, say, for example, your breasts are smaller or if they're sagging a bit, and then you do either augmentation or lift or both, it becomes a little bit more noticeable.
Yeah.
Because it's like, whoa, okay, now I have this built up around the center and there's this like valley. And it can look a little off as far as the cleavage. And so when I get a patient that has pectus excavatum, I always say, hey, look, just FYI, you have this kind of variation, right, in your chest wall.
You can always say medically speaking.
Medically speaking, I'm not picking on you, I have to point this out. But no, I want them to know because, they may have in their mind, I'm going to go do breast surgery and everything's going to look perfect.
Yeah.
And because of the way their chest wall is, it may or may not. So the next one is the opposite issue, which we didn't talk about last time, which is pectus carinatum, also known as pigeon chest. And it's the opposite. Instead of the chest indenting in, it points out. So throw that next pick up. Yeah, so that's a pretty noticeable pectus carinatum. Most of the ones I see are not that kind of noticeable.
Yeah, I've only ever noticed any of those like chest abnormalities that we're talking about on dudes. I've
Really?
never seen it on any girls.
They are they're more prone for men, right? We
Yeah.
talked about that. 4 to 1, right? Yeah.
I went
4
to a
to
CrossFit gym and one of the
Yeah.
owners, he had that.
Had it.
And I was
Yeah.
always like, what do you do? What is this?
1.
And he was like, he
What do you
didn't
have?
care at all.
Yeah, he was
you
like
know?
open about it.
Yeah.
So the problem with pectus carinatum is that specific to breast surgery is that because the chest kind of points outward in the center, it can make the cleavage harder to define, right? Because
Yeah,
cleavage
'cause
is
it'll
expected
go.
to be like whoop, right?
Uh-huh.
And if you got a point there, it could be like whoop whoop whoop. It'd be like a little
Yeah.
extra kind of thing in the middle.
And it could cause your
Yes.
implants to go like this way.
It could too. Depending on the severity, it could cause the implants to be pushed slightly outward. That's very smart. That was actually the next point here. Breasts
Yes.
tilt out. Did you read that off that, or did you just know that?
I mean, I'm just thinking, like,
That's very good. You get a gold star today.
thank you. I have
Brenda's
so many.
Brenda's working up for a gold. She's gonna say something really profound in a minute, and her demerits can go away. So the other one that's also super common is what I just call having a wide chest wall. So this basically is the intermammary distance. So breasts don't always sit the same distance apart.
Okay.
So for me, like what I consider normal intermammary distance, or the distance in the center between the breasts, like a centimeter to centimeter and a half or 2 centimeters is kind of normal. If they're really close, it might be like a half centimeter, which is really, really small. So that's kind of normal spread of the breast. But I've seen people with 4 centimeters, like the breasts are this far apart, 4.5. They can be really far apart. And then the issue is making that cleavage that most people want, right? Because the breasts are just far away. And patients are always like, well, can't you just move the breast inward? Not really. Like, you can't really shift the whole foundation of the breast in one direction in a noticeable amount, or things start to become discombobulated because all of basically the projections and nipple positions start to come like undone, and it just doesn't look right.
Right.
So, if you're doing augs or lifts, like having that extra volume in the center makes the breasts look closer together. But if you have a wide chest wall, it's just kind of one of those things where you just have a wide chest wall. Sorry?
I said I see.
Oh, yeah. The next one is what I call canted or sloped chest. So what this means is, I'd say the majority of people have a flat chest wall, meaning when the breasts are perky, they point straight ahead, okay? So the alternative to that, if you were looking at it like this, would be a canted or curved chest wall. So when that happens, the breast, which normally would be pointing like this, point like that.
So is it similar to the pigeon-ish?
It is, except there's not a chest wall deformity. Like the chest is flat, but then it curves. So like pigeon would be like this, like
Mhm.
there's actually a point. So this would be like considered normal, this would be pigeon, and then this would be canted.
Okay.
So like there's not like a point in the center, but the chest wall curves. And so what happens is the breasts again point outward a bit.
Okay.
And they may or may not be slightly further apart, with a canted chest.
Yeah.
And so when people have a canted chest, I always point it out to them because when you do an aug or you do a lift and suddenly the breasts are like perky and full, like they're going to be more noticeably pointing away from each other.
Yeah.
And if they don't have a lot of breast tissue, or especially if they have a little bit of sag to their breast, they may not notice that. And I want them to be aware that, hey, your breasts are going to point outward a bit, because you just don't want someone to go through surgery and then have a result where they're like, oh my gosh, I didn't know this is what it was going to be.
Yeah.
So again, good doctor-patient relationship, making sure the patients understand, because a lot of these things patients don't know they have, right? They don't think about it, or they don't think how it might impact, the outcome of surgery.
Yeah.
Yeah. And then the last one would just be straight up chest wall asymmetries. And so what I mean by that is you will find people like, okay, normal chest wall, but this person has a chest wall like that.
Dude, I think I have that.
Do you?
Yeah.
You might. I mean, it's possible. It's interesting because when people have something like that, in order to make the breasts look the same, especially if you're doing like either reduction or aug, meaning you're changing the size, a lot of times you have to, over-treat one side to make them look the same.
Yeah, my little card that my doctor gave me one of mine has more cc's of.
Yeah, and
stuff in
so that could be from two reasons. The most common reason that would be is you just have one breast that's bigger than the other. Yeah. Or
Which is totally normal,
it
apparently.
is very normal. Yeah, like 80% of women have one breast that's larger, noticeably than the other. But the other reason is if your breasts were exactly the same size, but one chest wall sat lower down, then the way you could compensate for the breasts not being the same is you put a little bit more volume in the side where the chest wall sunken in to compensate for it.
Yeah, I feel like the only time I ever notice is whenever I flex my chest muscles.
You can see it then, yeah.
Yeah, I feel like.
Yeah. So asymmetry of chest wall is, you see it from time to time. I'd say the other ones are more common. But just the other day I had a patient where like her breast was actually bigger on the left side, but because her chest wall was sunken in to make them look normal, I had to use a bigger implant on the bigger side, which is counterintuitive.
Yeah.
Right? You always think, well, if one side's bigger, use a smaller implant over there. But because that chest wall was sunken, I had to actually put extra volume in there to make it look right. And it came out great, but you got to put your thinking cap on.
Yeah.
You don't want to be like having your you don't want to be having your breast dog like down under the bridge somewhere where they don't think.
Yeah.
And you come out all asymmetry and wonky. Yeah.
Don't go. Yeah.
Did they? So when you did I know you're very open about this, so I'm going to ask you open and not embarrassing. Like, did they even talk about your chest wall when you did your exam?
I don't remember. The only thing they said about my chest wall was like, because I've always been athletic and worked out.
You said you're muscly.
They just said like, you're very muscular, so we have to go underneath your chest cavity, because I guess or chest muscle, because I guess back then it was still normal to do above.
Yeah, you do above or below, yeah.
Yeah. And
wait, what year was that?
like, I've had these for like 11 or 12 years.
Oh, actually, back then it was mostly under, but yeah.
But I had an old surgeon. He was an older guy.
Right.
Gray haired and all.
Yeah, rode his dinosaur into work.
Yeah, he was Scottish too.
Oh, Scottish was he? Okay,
Yeah.
Very good. Did he wear a kilt?
No, he probably did have one.
Probably.
His accent was very heavy.
Yeah.
Mrs. Doubtfire.
Was it?
Yes.
Yeah. All right. Let me recap this one real quick. So today we were talking about something that not a lot of people talk about in the plastic surgery world, but it does make a big difference. And that is how the shape of your chest can affect breast surgery. And this comes from a segment we did a few weeks back about Tori Spelling, who has a pectus excavatum, which is a indentation in the chest. And someone noticed it, or people have been noticing it her whole life, and she was talking about it on her podcast. So I was talking about the different shapes of chest and how they affect potential breast surgery, whether it be augmentation, lift, reduction. So there's pectus excavatum, where the chest wall indents inward, which can affect how the cleavage looks. There's the opposite of that, which is pectus carinatum, where it's actually a pigeon chest, or it's tinted upward, which also affects the delineation of how the cleavage could look. Another one I see a lot is where the breasts are wide set apart, which again affects cleavage and how much cleavage you have if the breasts sit further apart. The other one is just straight up chest wall asymmetries, where if one chest wall is lower than the other, where you would have to use a bigger implant to compensate to make the breast look bigger. And the other one I see quite a bit of is canted or sloped chests, where the chest wall has a curve and then the breasts kind of sit like that. And you just want to make sure that patients know they have that. Because again, making sure that the expectations of the outcome of surgery is the same in the surgeon's mind as it is in the patient's mind will give you the best results. So, cool.
Yay.
All right, we got a crazy story. Bruno, you haven't heard any crazy stories yet, but this one is pretty crazy.
I'm excited.
There's a lot I don't like about this next story. This is about a model whose butt implant fell out when she was working out at the gym.
What kind of model is she?
Self-proclaimed, allegedly. Yeah.
Oh, like an Instagram model.
Yeah, Instagram model. Yeah.
I hope she wasn't wearing shorts.
I know,
Yeah.
like it fell out like on the floor. What do you do, like if you're
Fell out on the.
if you're working at the gym and like someone's
What is it
implant
like? Fall out into your calf or something?
Yeah, like where does it fall out? I don't-
Into your thigh? Do you have like a butt on your thigh or something?
No, I think it fell out of her body.
Gross. What? How did
Yeah,
that
exactly.
happen?
I told you.
Is
This
she
is
working
crazy-
out? Is she
Yes.
working out with an incision or something?
Well, yeah, obviously there's an incision to put in the butt implant. I can tell you how this went down. I don't know exactly. I wasn't there. There's no video. I kind of wish there was. Oh, it was crazy that might
I'm
be.
like, are we sure she wasn't wearing butt like pads that you stick in?
No, no.
to
This
your
is like a
pants?
real story. You can look this up on the interwebs. So UK, United Kingdom self-proclaimed model, so I think she's like an Instagram model,
Mhm.
Chelsea Robinson flew to the Dominican Republic.
Cool.
You know how I feel about medical tourism. I don't like
Butts
it.
And tourism.
Yes, butt surgery and tourism are a bad mix. So she went to the Dominican Republic not to get a Brazilian butt lift, which I hate Brazilian butt lifts. I think I almost hate butt.
But would you rather get implants or BBL?
Is someone putting a gun to my head and I
Yeah.
have to pick between the two?
Yeah. If you had like the best surgeon ever.
I'd probably go with the BBL
Yeah. I
because
think I would too.
the butt implants are, I mean, as insane as that sounds, like, I don't know. I would rather just die, I think. If I either one.
No, you
Just
wouldn't.
shoot me. Do I can't pick something
Shoot me
else?
in the butt.
Oh my gosh. So yeah, I don't like medical tourism, and I really don't like butt implants. I actually hate them worse to BBLs,
Yeah.
which is hard to believe, because the butt implants have an even higher complication rate than BBL, if you can believe that.
Yeah, because you use your butt a lot.
Yeah, you sit on it a lot.
Yeah.
Yeah,
And that's a
exactly.
huge muscle though.
Right, I know. It's like just dying to push that implant out to the floor.
Gross.
So complication rates in big studies are as high as 1 in 3 or 33% for butt implants compared to BBLs, which is around 7 to 10%. However, it is worth noting that death is one of the more common complications of BBL surgery.
Yeah.
So there is that.
Dangerous.
Yeah, it's dangerous. So what are the risks of getting butt implants? Implant rupture, just like, breast implants. Displacement, that's a big one. So I'll go through these and I'll tell you what's important. Infection's a risk, contracture, capsular contracture, just like with breast implants, implant rotation and shifting. So the problem with butt implants, they don't work anywhere close to as good as breast implants because you're always sitting on them.
Yeah.
And like that really makes a high risk of these implants getting where they shouldn't be, or turning, or in this case, bursting through the incision and ending up on the floor of the gym. Like historically, butt implant surgeries are bad. Like, just don't do it. I mean, I hate to say it, but between a butt implant and a BBL, I think BBL is your better choice. I mean, if you live through the surgery, at least your butt implant's not going to end up on the floor of Gold's Gym, one day. So, I mean, they're all bad. I don't like any of them. This girl, God bless her, started doing plastic surgery at 18. She's allegedly spent like $150,000 on plastic surgery over her life. There's just a lot of badness going on with this story. I mean, I assume she has some sort of dysmorphic body disorder. She's getting that with plastic surgery, and then you feel bad for her because she says it's the industry pressure that's making her get all this surgery. Going and getting a big surgery like that out of the country, bad idea. The only kind of missing puzzle piece in this whole story that I really want to know is how far out she was from her surgery before she went to the gym.
Yeah, it must have been really
I mean,
no time.
yeah,
How
and that's
could
going to
that
be a
happen?
problem. If it was a short time, then that's a problem with having medical tourism, because any normal doctor you see, you're going to follow up with them. And I have these conversations with every single one of my surgical patients of, okay, you're now 3 weeks out from surgery. This is what you can and can't do
Mhm.
in the time, after you leave here up until your next visit.
Yeah.
Like, it's very clear. And you bring up the great point of, is the most likely scenario is she went back to the gym too soon. She was doing squats, which really puts a lot of pressure on the butt muscle, and it pushed on the implant, and that rascal just squirted right out onto the floor. Like, it could happen. I mean, I could see how that happens.
So weird.
Yeah, I thought about like trying to do an AI video of this
Would there
going
be
down.
like blood everywhere?
No, there would not actually, because, well, there might be a little bit from the incision, but like the pocket where that implant lives is pretty, dry. It's not like raw. Okay.
So creepy.
Yeah, right. I mean, what if there were children in there and they saw that happen? They'd probably
Like, what if you were in there? You'd be like, bro.
I would like turn around and walk out the door and pretend like I was not a doctor.
I'd be like, you dropped something.
You dropped your
Right.
butt.
Do you pick it up? Like, it's probably like contaminated, right? Yeah,
Yeah,
I don't
what's
know.
in
I
her
wouldn't pick it. I'd
butt?
have to get like a hazmat suit to touch that thing.
I'm sorry, I'm laughing, but
I know it's very sad, but
that's
also,
probably really embarrassing.
yeah, that would be embarrassing if your butt implant fell out at the gym. I feel bad for her. I feel like that she's really kind of been
This
taken
is a
advantage
horrible-
of by like society.
You know what I say to that? It's
What?
if you have body dysmorphia, you do not need to be on social media.
No, you do not.
Because
That's a
honestly,
great
if
point.
they're just if you go to the beach and you look at people there,
Yeah.
they look like normal
Yeah, regular, normal people.
freaking people.
Yeah.
None of them
On
are
social media,
supermodels.
everyone's like a
Yeah,
glam.
because the
glamour
only
model.
ones that are posting bikini
Right.
pictures are the ones
Right.
that are like that's their job is to post
Yeah.
pictures of themselves half
Yeah,
naked.
social media has like warped everything.
Yeah, so it's like,
So that's why we have our own show on social media.
but we're the
good
truth
guys.
advocates.
Yeah, we're the truth. And yes, we are the truth advocates. So yeah, I think this is kind of a perfect storm of, having a bad procedure, doing medical tourism to get the bad procedure in a
Mhm.
person who probably shouldn't be getting plastic surgery anyway.
Dude, I bet she was approached too. I bet like a social media person from Mexico,
Kind of Dominica or whatever.
DM'd
Reached
her
out
and
to
was
her.
like, "Hey, what if I give you this
Free butt
implant
implants.
and we'll knock off a price
Oh.
or for free or some other stupid thing?"
I do have a picture of butt implants, Brenda. Throw them up there. Like, I don't do butt implants. They look kind of similar to breast implants.
So the breast implants on the left.
No, they're both butt implants. One's
Ew.
oval and one's circular. Yeah.
Gosh.
Yeah, they're just not great surgeries. Yeah,
Mm.
not a fan. All right, let me recap this one real quick, Brenna. Then we're going to move on, and Sarah's going to teach me something. So today we're talking about this absolutely insane story coming out of the UK of I believe, an Instagram model who did medical tourism, which I really don't like that. I don't like medical tourism. And she went and she got butt implants, not even a BBL, which it's even possible I hate butt implants worse than BBLs. And she went back home, and not sure exactly how long after her surgery, but she went to the gym and she was working out, and her butt implant came out of her and out her incision and ended up on the floor of the gym allegedly. And so we are talking about how crazy that is, and I went into some detail about how I do not like butt implant surgery. They are very, very prone to problems. Some of the big research papers on butt implant surgery show a complication rate as high as like 30 to 33%. Like 1 in 3 patients have a complication. That is insanely high, versus BBL, which is around 7 to 10%. Of course, we do have to mention that risk of death with BBLs is much, much higher than other plastic surgeries. So yeah, pretty crazy story. Lots of bad things happening here. This poor model says she's been pressured by society to get like $150,000 worth of plastic surgery. She's doing medical tourism. She's getting butt implants. It's all just like about to melt my brain. So yeah, it was a pretty crazy story.
Sad.
Yeah, sad. Okay, teach me and Brenna something interesting, Sarah.
Okay, cool. So this is about peptide therapy.
Peptide therapy.
Yeah. So I actually started taking a peptide called sermorelin.
Okay, so peptide, so like a messenger. Well, peptides.
So it's
Yeah.
a peptide is just like semaglutide, and we all know what semaglutide is.
Yeah. Yeah, and they're
it-
amino acids that act as messengers in the
Yeah.
body,
yeah.
among other things.
Yeah.
So this is okay. So this is a messenger for something specific.
So yeah,
it's like semaglutide. It triggers something.
yeah.
Right?
So this is a peptide that tells your pituitary gland to produce more of your own natural growth hormone.
Okay, so it's for like you take it for working out.
Yes. So
Okay.
the way it works, it's used for fat loss, better sleep, workout recovery, muscle tone, anti-aging, and one of the reasons why I thought it was really cool is I have issues with my blood pressure, and it's been known
Really?
to lower your blood pressure. Yeah, I have like high blood pressure.
Do you?
Yeah,
Now, do you? Can I ask you like a medical question?
sure.
Do you take like birth control pills?
No,
Oh, you don't. Okay.
I stopped taking it.
Because of the blood pressure?
Well, yeah, that, and
Yeah.
I just think it's
That's
bad
a
for you.
yeah. That's a super common thing that.
I used to take loloestrin, which is for people that one of the reasons why people take it is because if they have high blood pressure.
Oh, really?
Hmm.
Yeah. I know my wife at one point was having to juggle medications because of that.
Yeah.
Yeah. That's a common one.
Hmm.
Okay. So, all right. Well, lots of questions here.
So I take it for pretty much all of those reasons.
And how long have you been taking it?
Just a month.
Okay. Have you noticed any difference?
A little bit. So,
Okay.
because I've only been taking it for a month. Because how it works is it's more of a consistency based type of peptide. It's not going to work immediately. It's more of a tool in your toolbox instead of like getting Botox and your wrinkles are gone.
Okay.
You know?
So it's just like an addition to other things you're doing kind of thing.
Yes.
Now, you know what I'm going to ask you.
What?
Is there any research on it?
Yeah, I actually looked at it. I got a lot of my information from the HCG Institute, and I think it's it's like hormone, some type of therapy place, and I found it on Google Scholar. So hopefully that's enough.
Hopefully it's legit. All right.
And I went to a doctor to get all of this. I'm not just like buying it because you can buy this stuff off the internet if you want to, which I do.
Okay, that's a good question I didn't think of. So this is prescription Sir Mix-a-Lot. What's it called?
Sir Mix-a-Lot. Sir Moreland.
Sir Moreland.
Yeah.
Sir Moreland. Okay.
Yeah. So in my experience so far, you take it for or once a day at night.
Is it like a pill or a shot?
It's a shot. So it's like
you have to take a shot every single day.
It's just like a little bitty shot. It's like a little bitty. The needle's like literally like
tiny.
Yeah, super small. Don't even feel it. Anyways, so my results so far is I've noticed I fall asleep faster.
Okay.
And I think depending on if I was retaining water or not or less.
Yes.
I've lost about like half an inch of on my stomach. Yeah.
Wow.
So I thought that was cool.
Yeah.
And so far I haven't really noticed any side effects.
Okay. Are there listed side effects for taking?
There are. I didn't put them on there, but like
what's the
I guess the most major one is just irritation at your injection spot.
Okay. Well, that's.
And then other ones are like nausea or sometimes insomnia.
Really?
Oh. Because it messes. Cause sometimes I guess it can mess with your sleep cycle.
Are you supposed to take it at a certain time of the day?
At night.
Oh, you take it at night. Okay.
Yeah. So how it works is the growth hormone. So your growth hormone is most active during sleep and recovery.
Okay.
And that's when fat is broken down.
Okay.
Muscles repair and tone, and metabolism stays elevated. So Sermorelin helps optimize that window by encouraging more natural growth hormone release. So whenever you take it at night, it's supposed to help you recover faster. So all the work you did in the gym, it's supposed to help recover your muscles and increase your metabolism. And so that's why I say it's like a tool.
Right.
It's just supposed to make all the effort you do in the gym and in the kitchen, eating, it's supposed to just elevate that and make it more worth it.
So do people that aren't working out take this medication? Do you know, or is it only people?
I don't know. In my opinion, and what I have seen from other people I know that have taken it, it's mostly for people that want to see better results for stuff that they're already doing. So say you're
Like running, like I am.
yeah,
I've been
so
running a
say-
lot, by the way. I haven't mentioned this to you.
good.
Yeah.
So say you're hitting the
Right.
gym and you're eating correctly
Uh-huh.
and you saw good results.
Yeah.
And you're at that plateau where you aren't really getting
I see.
anything happening.
It's like another tool.
It just kind of puts more gas on the pedal, you know?
Gotcha. Okay.
And it kind of just puts more positive output better. But you have to do it for a longer period of time. It's more of a consistency thing, and you're not going to see results immediately. It's like
Right.
it comes with overtime. You have
Yeah.
to take it for a little bit longer.
It reminds me of the creatine that I used to take, and like you have to take it for 8 weeks before
I
you
take
know.
creatine too.
Yeah, you have to take it forever before you like notice any difference.
Yeah. So, and then there's another peptide that I wanted to talk about that's kind
Okay.
of like Samorelin. It's called Ipamorelin or Ipamorelin,
Okay.
and it's similar to Samorelin in that it it's good for like muscle growth.
Does it
stuff like
stimulate
that.
the same receptors?
No, it doesn't.
A different one. Okay.
So you might know this. Like, what does semaglutide stimulate?
It simulates the one that affects your hunger, like your basically your satiation.
Yeah. So that meant it's
receptors.
called ghrelin.
Huh?
Ghrelin is
that the specific
hunger
receptor?
hormone.
Oh, okay.
So ipamorelin actually mimics ghrelin.
Oh.
But the thing is, it doesn't mess with
With
your
the
actual
empty.
hunger, like you
Oh.
being more full or more hungry.
So what does it do?
It only mimics the growth hormone stimulating part of
Oh,
ghrelin.
I see. So
It
it's
doesn't spike your appetite or
Okay.
lower it.
So it's similar to the sermorelin.
So it has the same thing, except ipamorelin is more faster.
Oh.
So it's something that my doctor didn't recommend it for me because I'm already pretty healthy
Mhm.
and all of that stuff. So she said, like, if you don't want these extreme results, it's more for an extreme result if that's what you want.
Gotcha.
So
So you haven't tried that one.
nah.
You tried the sermorelin first.
Mm-mm.
Yeah.
And some people stack them, so you can take
Oh my
it
gosh.
ipamorelin and sermorelin at the same time.
And people are buying this off the internet, I assume.
You can, and
Can
it's
you?
like, and like some of them are labeled like for animal use,
Oh my god.
all kinds of stuff. And I don't. Obviously, I went to a doctor.
You have to go to a special doctor to get this?
It's like
Family practice?
somebody who, and you have to go to a doctor that's an advocate for this type of therapy. So like doctors that are advocates for hormone therapy
I
and
see.
like more of like
Gotcha.
supplementation,
Yeah.
and they're just
Hmm.
that's just more of how they
Ah.
treat their patients. And so since we're talking about peptides, I wanted to talk about semaglutide and how it's just a little different because they both are peptides.
Okay.
So Samorelin, it targets the pituitary, then a growth hormone, and then its goal is fat metabolism and recovery. And then
Okay.
semaglutide is more of gut and brain, and then obviously it stimulates GLP-1, and that messes or that's
Stomach motility and
Yeah.
satiation. Yeah.
yeah, that's more with your appetite and blood sugar. And so when you think about those things, what are these peptides better for? So Samorelin is better for active people focusing on body composition.
Mhm.
So if you want to have good muscle tone
Mhm.
and lower fat composition, then you should probably
Dude,
take
I'm honestly interested in this. I'm
Yeah.
gonna look it up. I
And
mean, 'cause I'm
then
on this new kick
semaglutide-
right now.
Yeah, and then obviously semaglutide is for people that want to control their actual weight, like
Yeah,
poundage.
Yeah.
Because body composition is not poundage. Because you could weigh,
Right.
I weigh 130 pounds, and I'm like a size 1 or a 0 sometimes.
Right. Because you're muscly.
Yeah, but like
Muscle's
some
heavy.
people that are 130 pounds are like a size 8.
Yeah.
It doesn't.
100%.
That's not the
Right. You're
issue.
not concerned about like the scale weight because
Mhm.
like your
I'm just
body
concerned
fat's
about
got to be like super
composition.
low. Yeah.
Yeah. So, yeah, like you said, it all depends on your
Yeah.
goal. So,
Interesting.
but at the end of the day, you need to go talk to your doctor. You need to get
Yes,
your blood work
definitely.
done, your vitals, and they need to be able to say
Sure.
that this is good for
Yeah.
you.
That's a really
Because it does mess with your hormones.
Yeah,
If you
that-
don't have normal hormones, this is not for you.
That's a great point. You know, all these things, you know, semaglutide included, like you really need a doctor visit, you know, and I think that's really important. And it sounds like the Sermorelin is along those same lines, although it does completely different things. Where, yeah, I would not recommend someone just get this off the internet and take it because you could end up, I would suspect it like there's no like critical risk factors or potential complications from it. But I mean, it could mess you up if you.
Yeah, I would
did it
say,
wrong.
I
Yeah.
mean, I'm sure whatever complications that come from semaglutide are probably similar to
Could be, yeah,
Sermorelin.
could be.
But I thought it would be interesting. I know, obviously, you said you're not familiar with it, but
No, I'm not. Yeah.
but since you prescribe semaglutide, right?
Yes.
Do you ever see a future for you to offer it to
Maybe
people?
I'd have
Like
to
if
look
you
into
do
it.
your
Like,
own research.
yeah, I
stuff
literally
like
have never heard of it before. So
Yeah.
yeah, I'd have to look into. Are you getting? So let me ask you this: are you getting like brand names for Morlin, or are you getting like a compounded one?
I don't know. The pharmacy that I use is or the doctor's office uses is called like Baker's or something, and they're like
Well, you know by the packaging. Does it
Mhm.
come in like individually labeled, like a fancy
it
brand
might
package?
have a brand on it.
It may.
I can tell you what it is.
Snap a pic, send it to me.
Yeah,
Yeah,
and you can look into
that'd be
it.
interesting. I'm sure that they will start compounding if they haven't already.
Yeah.
Like compounding's hot right now.
Yeah, I think that's what that pharmacy does.
Oh, they do compound it.
Mhm.
Yeah. Oh, okay. Yeah, you just want to make sure the pharmacy is like legit because there's
Mhm.
just like everything. There's like better ones out there and
Mhm.
ones that are not so great. So
Oh, I didn't know that. But yeah, I thought it was
Yeah.
interesting. I remember talking to my sister about it. She's a nurse
Yeah.
practitioner and she prescribes semaglutide all the time.
hmm
And I
Yeah.
was just telling her about it. And
Yeah.
she was like, And she was just like very interested.
Yeah,
in
I'm
it
gonna
as
look
well.
into it. Actually, that you mentioned it because I knew zero about it. I always love when you bring something. I have no idea what you're talking about. Because you know I like to learn new stuff.
Yeah, I'm
Brenda-
excited to see
Brenda,
what
I
happens.
can see Brenda's eyes lighting up. She's like, yeah, I definitely. That was a good topic.
I'm excited to see what my
Yeah, I
results
want
will
I
be.
want a full report and like. So when does it like hit max effect for you? Like in 2 or 3 months? Or?
Yeah,
Okay.
it's like
cool.
a 3-month situation.
Okay, I need a follow-up story
Mhm.
on your Sir Morlin.
Yeah, I need
journey.
to take. I need to take.
Are you making
body
posts about it?
measurements. No, I've never posted about it.
Oh. Yeah, I was curious. I'm terrible about following your Insta. I didn't even know you got engaged. I felt like a total ass the other day whenever you're like, I got engaged. I'm like, oh crap. I'm bad. Terrible friend.
Shut up. No, it's
So,
fine.
well, that was a good one. I want a full report on that, and I'm gonna look it up too.
Yeah, you
just to-
should. I think it's
yeah.
gonna be really great
The
for
next
people
big
that
thing could be.
people that are
Yeah.
like, dang,
Yeah.
I need to lose weight, but I don't, or fat.
Right. Yeah, but they're not wanting to take semaglutide.
Yeah.
Okie dokie. I do think that is all the time that we have for segments today. We will not be live next week, but we will have something there. I think we're going to do Sarah and I's first episode as kind of like a nostalgic journey back 3 years ago. I don't know. Maybe we'll do a best of. I haven't decided. But anyway, thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button. Leave us a comment. We'd love to hear from you. And we will see you next time on Nip Talk.
Bye.